emotional and mental health needs practice test for the CNA. A resident in your care is frustrated, upset, and raising his voice in complaint. Which of these is the best response to his actions? A. Walk away from the patient in an effort to show you won't tolerate the behavior. B. Ask the resident to lower his voice in courtesy to other residents who are getting upset. C. Report the incident to the supervising nurse. D. Offer support and care using a comforting and calming manner. The correct answer is D. Offer support and care using a comforting and calming manner. Offering support and care to an unruly resident shows concern for his or her needs. A comforting and calming manner is a positive response. The other options are either negative and could escalate the resident's agitation, or they avoid dealing with the problem. When a patient is dying, the last of the 5 senses the patient loses is A. Sight. B. Hearing. C. Taste. D. Touch. The correct answer is B. Hearing. Family members and visitors need to know that even if a patient cannot communicate, they may still hear what is being said to them. While the other senses may be lost, in most cases hearing is the last sense to be lost for a dying patient. A resident in your care has just received news of a death in the family. What is the best way to assist them with the grieving process? A. Tell the resident about an experience you had with death and what helped you cope with it. B. Remind the resident that death is inevitable. C. Spend some time with the resident, particularly offering support if he or she wishes to talk about it. D. Suggest that the resident get his or her mind off of things by thinking of something pleasant. The correct answer is C. Spend some time with the resident, particularly offering support if he or she wishes to talk about it. Sitting quietly and listening makes the resident feel comfortable enough to talk through his or her feelings. The other options tend to discount the resident's immediate feelings of despair. Elizabeth Kubler-Ross describes the stages of grief a person goes through when they lose someone close to them. She believes the first stage of the grieving process is A. Acceptance. B. Anger. C. Denial. D. Depression. The correct answer is C. Denial. Kubler-Ross believes a person's first reaction when facing a death is denial. People normally move on to experience the other stages listed, but denial is typically the first. As a nursing assistant, you may encounter residents who are anxious or feeling unsettled about either their circumstances or surroundings. The best response in dealing with this anxiety is to A. Leave the room so the resident can regroup and refocus in private. B. Speak in a calm voice and exhibit a calm and comforting demeanor. C. Open the shades to let in more light and brighten the surroundings. D. Turn on the radio or television to distract the resident from their immediate thoughts. The correct answer is B. Speak in a calm voice and exhibit a calm and comforting demeanor. Reducing stimuli during anxious times brings relief to anxiety. The other options bring additional stimuli into an environment that is already tense or may make the patient feel more anxious and confused. A resident who consistently becomes more confused during dusk, early evening, or during the night is most likely suffering from A. Dementia. B. Psychosis. C. Alzheimer's disease. D. Sundowner syndrome. The correct answer is D. Sundowner syndrome. Sundowner syndrome involves a pronounced increase in confusion and agitation that occurs at the end of the day. This phenomenon is thought to be triggered by the fading light and increased shadows, which may cause disorientation. A resident catches you off guard with a comment that is sexual. Your best response would be to A. Make a humorous comment in return. B. Let the resident know that the comment is not acceptable to you. C. Change the conversation to a different subject. D. Walk away and pretend you did not hear it. The correct answer is B. Let the resident know that the comment is not acceptable to you. It is important for the resident to know you will not accept further comments of this nature. It establishes a boundary for his or her behavior with you in the future. It is also important you inform the supervising nurse. A resident died and his roommate is upset and wants to discuss it with you. What is the best action to take? A. Talk to the patient about a time you lost someone you loved and how you dealt with it. B. Try and distract the patient by changing the subject and bringing up something happy. C. Remind the patient that death is a natural part of life and reassure him his roommate had a great life and is in a better place. D. Talk with the roommate and allow him to express his feelings. The correct answer is D. Talk with the roommate and allow him to express his feelings. Allowing the resident to talk about his roommate's death will help him deal with his feelings and help alert you if further counseling or follow-up is needed. The other options discredit the patient's feelings and are not therapeutic. A resident is pacing around his room, yelling and swearing. What is the first action the nursing assistant should take? A. Tell the resident to calm down. B. Call the charge nurse. C. Call the resident's family to assist with the situation. D. Attempt to apply restraints. The correct answer is B. Call the charge nurse. Calling the charge nurse is the best option in this situation. The nurse may have to give the patient medication to calm him down or involve another member of the team to assist with the situation. The other options may aggravate the resident more, and attempting to put restraints on the resident may place the nursing assistant in harm's way. Which of these is not a normal biological change to the body from the aging process? A. The ability to make decisions is weakened. B. Bones become thinner and less strong. C. The movement of food from the digestive system becomes slower. D. Joints become stiffer and less flexible. The correct answer is A. The ability to make decisions is weakened. The inability to make decisions is a process that would be linked to disease as opposed to a normal biological change that occurs during the aging process. Biologically, bones become thinner and less strong, joints become stiffer and less flexible, and the movement of food through our digestive system slows down. Which of these is not a common cause of constipation? A. A low-fiber diet. B. Not drinking enough water. C. An increase in intestinal motility. D. Ignoring the urge to go. The correct answer is C. An increase in intestinal motility. When intestinal motility slows down, constipation can occur. So an increase in motility is the correct answer because it would not cause constipation. Lack of fiber in a diet, ignoring the urge to go, and not drinking enough water are all common causes of constipation. Which of these is not a sign of depression? A. Withdrawal. B. Increased interest in participating in social activities. C. A decrease in appetite. D. Increased amount of time sleeping. The correct answer is D. Increased amount of time sleeping. When people are suffering from depression, their desire to be involved in activities does not increase, so this is the correct answer. A person's interest in activity actually decreases when he or she is suffering from depression. The other options are common signs of depression: an increase in the amount of time sleeping, a decrease in appetite, and withdrawal from socializing. All of these are ways that a nursing assistant can help a resident who is dealing with his or her impending death, except A. Sitting and listening if the resident wants to talk about it. B. Giving the resident privacy if they ask for it. C. Spending more time with the resident than you normally would so you are available to offer support. D. Spending less time with the resident so there is no pressure to be sociable. The correct answer is D. Spending less time with the resident so there is no pressure to be sociable. Residents often want someone to just sit quietly so that they are not alone in dealing with their thoughts. They may want someone to sit and listen as they talk through their feelings and fears. Spending less time with a resident may add to feelings of isolation while dealing with the situation. The other options provide support, as needed, and respect the wishes of the resident. A resident recently learned that her spouse has died. The best response the nursing assistant can give is to A. Introduce humor to lighten the mood. B. Sit and offer support if the resident wants to talk about it. C. Ignore the topic and switch the conversation if the resident gets emotional so it takes his or her mind off of it. D. Bring in other residents frequently so it occupies the resident's time. The correct answer is B. Sit and offer support if the resident wants to talk about it. A resident who has lost a loved one may need to talk about his or her feelings or memories of the lost loved one. Often, just sitting and holding the resident's hand provides the comfort needed. Ignoring the topic, switching the conversation, using humor, or introducing others into the room when they may not know what to say prevents the resident from dealing with his or her grief. Which of these is not an appropriate way to deal with the stress of being a caregiver? A. Join a new club. B. Talk to your coworkers about your patients during lunch to vent frustrations. C. Learn something new. D. Exercise and get outside for fresh air. The correct answer is B. Talk to your coworkers about your patients during lunch to vent frustrations. While it can be therapeutic to share similar problems and get advice from your peers, talking about the residents is a violation of their privacy. Exercise, getting outside for fresh air, learning something new, or joining a new club are all positive and healthy ways of dealing with something stressful. A family member is angry that her loved one is unhappy. As a nursing assistant, the best way to handle the situation is to A. Tell her you will leave for a few minutes so she can calm down. B. Ask her to put the complaints in writing. C. Calmly explain it is not your responsibility to discuss the resident's care. D. Listen politely and tell her you will share her concerns with the nurse. The correct answer is D. Listen politely and tell her you will share her concerns with the nurse. The best response is to listen politely and share any concerns with the nurse. The other options do nothing to give the family member hope of resolution. Asking her to put her complaint in writing or telling her that you cannot discuss it is dismissive and blocks further communication. Telling her you will leave until she calms down implies she is unjustified in being upset. Encouraging residents to participate in their care and in activities helps with emotional and mental health needs by A. Making them more mobile. B. Relieving the burden on the caregiver, who already has too many tasks to complete. C. Holding them accountable for completing tasks. D. Improving their sense of independence and outlook. The correct answer is D. Improving their sense of independence and outlook. One of the biggest struggles with residents who must rely on others for assistance is a loss of independence. This loss affects their personality and outlook. By having the residents participate in their care and in activities, even minimally, can cause a vast improvement in mood. Accountability should not be a primary motivator as it can add undue pressure. Mobility can contribute, but should not cause the participation to exceed what the resident is safe trying. Participation should not be encouraged solely to create fewer tasks for a caregiver. Which of these could be a major contributing factor to a resident's resentment of family members? A. A feeling of abandonment because of being placed in others' care. B. Missing annual birthday parties. C. Missing family meals together. D. A feeling of spiritual unrest by missing church attendance with family. The correct answer is A. A feeling of abandonment because of being placed in others' care. While all of these cases can contribute to resentment, it is extremely normal and common for residents to feel abandoned if family members can no longer assist them in the home or live with them. Having their care placed in strangers' hands is both scary and not necessarily a choice they would make. One of the characteristics that helps a nursing assistant care for residents is empathy. Which of these is the best definition of this term? A. The ability to be concerned about someone else's pain. B. The ability to feel pity for another person. C. The desire to help someone who is in pain. D. The ability to sense and understand what another person is feeling. The correct answer is D. The ability to sense and understand what another person is feeling. Feeling empathy means you can actually sense and feel what another person is feeling. You can temporarily put yourself in their shoes and imagine what it must feel like. Empathy goes beyond feeling concern or pity for another person. Those are traits of sympathy. The desire to help someone is compassion. All of these abilities are positive traits of a caring CNA. You can feel all these things and have empathy, but the correct answer choice is the best definition of empathy. You notice a change in a resident's mental condition. The best course of action is to A. Plan to spend extra time with this resident as he or she may need more assistance than normal. B. Report the change immediately to the charge nurse. C. Try to use a sense of humor to lighten the mood of the resident. D. Ask the resident if he or she has noticed a change in his or her personality. The correct answer is B. Report the change immediately to the charge nurse. If a resident's mental condition has changed, it is extremely important to report it immediately. Something more serious could have happened or could be prevented from happening by cueing in to subtle or overt changes. A resident may not notice the change, so asking him or her is not the correct choice. A sense of humor and increased patience is important and can help residents adjust to change. However, it should never be a substitute for reporting mental condition occurrences that deviate from normal behavior.